We've got a great session planned for y'all today. We'll go ahead and get rolling into it just so we can max the time. But today we are going through top 10 compliance tips for a successful 2022. We have an amazing partner with us today. Margaret's joining us, as well as if this is your first webinar with us, thrilled to also introduce you to Mike Rosen as well. And if some of y'all, I see a lot of familiar faces on the phone too. If you've been on webinars with us in the past, you've certainly heard from Mike in the past. But Mike and Margaret have worked together and have co-spoken together in the past. So we've got an awesome topic planned today. Couple of logistical things. We are recording this session. So after following the webinar today, you'll get an email from us that will have the recording. We also have a one-pager, just a tip sheet that y'all can use as you're thinking through budget planning and planning into 2022 for best practices, just to consolidate some of the info you'll hear today into a one-page takeaway. Would love for these to be interactive. So if you've got questions, drop them in the chat so we can get them to our speakers. We did carve out, we don't always do great at this, but we are going to do it today, is leave some time so that we can answer some questions live if you have them. So if you've got questions, drop them in for sure, and I'll do my best to make sure that we address all of them today. If we don't get a chance to address today, certainly we'll kick them to the speakers following the session. This is good for CEUs, so you will also get your CEU certificate from us following the session today. All that's confirmed, we have it in hand, we're ready to send it out when you need it. With that, we will go ahead and I will introduce our speakers. So Mike Rosen is the co-founder of ProviderTrust. I'll let him tell a little bit more about ProviderTrust and his story and his background in a second, but Mike is certainly a thought partner and a leader in the industry. He likes to refer to himself as a recovering attorney, but has really, when we started ProviderTrust years and years ago, his background from a legal perspective and a regulatory perspective allowed us to really shape our offering and allow us to continuously stay current on what's going on in the world of healthcare and how do we bring that guidance and insight to our clients and to our partners and to our friends. And then Margaret Scavotto is the president of Management Performance Associates, deals a lot with compliance as well. I'll let her tell you the story about what does MPA do, some of the work that they do from a HIPAA compliance standpoint, but she's also a thought leader in the industry. Speaks a ton on compliance related topics and has provided so much guidance, certainly to us and to our team over the years, and to many of y'all that are on the phone as well that we know. So with that, I will turn it over to Mike. Tell us a little bit about ProviderTrust, and then we'll pass to Margaret.
Thank you, Dave. Hello, everyone. It's hard to believe that we're talking about a whole nother year, 2022, but exciting, I think, for all of us. And as Dave mentioned, we have HCCA to thank for how we met Margaret. Margaret is a lawyer also by training and a very skilled, recovering, and a very skilled consultant when it comes to serious compliance issues. And we heard her speak and got a chance to meet her and became friends several years ago at HCCA. So we want to thank that organization for connecting us together. ProviderTrust, we are 11 years old, yay. And we're very excited for the work that we continue to be able to do, that we're honored to be able to do it. And we help, hopefully help you sleep better at night with regard to knowing about your employees and vendors and the compliance in that regard. As a result, there were several chances for us to work with MPA on some of their clients, and likewise when needs arise. So we're based in Nashville, and we love what we do. We love the clients that we have. So that is ProviderTrust, and we love doing these kind of webinars to keep things top of mind. Margaret, tell us all about you and MPA.
Thanks, David, and thanks, Mike, and thanks ProviderTrust for having me on this webinar. It's always a pleasure to collaborate with ProviderTrust and with Mike. Besides being recovering lawyers, we just have a lot in common. We like helping people with compliance, and a lot of my clients use ProviderTrust. So we've kind of gotten to know each other in a couple different ways. One on the exclusion screening, but also just in bouncing ideas around. So I'm glad we can do this together. So MPA is based in St. Louis. We've been helping healthcare providers for actually 26 years. We turned 26. That just doesn't look as fun on a graphic as 25th birthday, so I haven't changed it yet. But we're 26 years old, and MPA helps providers with compliance in HIPAA I'm a big believer that compliance needs to be an essential part of operations and part of your culture, and that we can make it fun and helpful and relevant, and be very forward thinking with compliance and HIPAA. So thank you for joining me, and Mike and everyone else at ProviderTrust here today.
I was on mute. I'll take us through the agenda and then I'll transition it back to Margaret. So here's what we're going to cover today. Top 10 tips. We usually do this right at the end of a calendar year. We host a webinar session like this that hopefully the goal today is to give you a little bit of a jump start into how you're thinking and mapping out your ways of working, certainly cross-functionally, but also within your compliance department specifically, going into the next calendar year. And so we do one of these every year. This is ours for thinking through 2022, but we'll cover top 10 tips. Gosh, it's hard to say that. I'm struggling to say that today. Top 10 tips. We'll touch on COVID and its impact, best practices, focus specifically on risk and audits. And then, as always, a common theme for us at ProviderTrust is how do we best connect and operationalize a working relationship between HR and compliance. And that's been such a topic over the last 2 years as we all navigate COVID, but it's been one that we continuously see innovation around and also continuously talk about. And then certainly I'll mention this once more. If you've got questions as we go, please drop them into the chat and I will make sure to get them answered and asked live here in the session. So with that, I will turn it over to Margaret to get us started.
Thanks, Dave. Okay, so Mike and I put together 10 compliance tips to help you be successful in 2022. And I think the timing of this is good. I know we've got about 19 months of COVID now. And I know that for so many providers, it has been a struggle, if not impossible, honestly, to keep up with our routine compliance tasks on top of the COVID tasks, which are just a mountain of new regulatory challenges. And so my first tip for 2022 is to triage. I think we're all familiar with that term from a healthcare patient care standpoint. I'm going to use it a little bit differently today, but the concept is the same. Working on the most essential items first, and then getting to the lower risk items down the road. And I say triage, but the other part of that is retriage. You are constantly going to be adjusting your compliance plan because COVID is just now part of our compliance plan. Most providers simply can't audit everything they want to or do all of the training that they want to. We have to pick and choose what to do now and what to do later, what to do monthly and what to do annually. This was true before COVID, and it's just even our to-do list is longer and our resources are scrunched. So we have to be very strategic and thoughtful about how we handle risks. So the first task in triaging is to identify your risks from a compliance standpoint. And there's a few sources of risks. First, I want you to look at the regulators, right? Oh, the OIG, the DOJ, the OCR, CMS. If you're in a nursing home, you need to look at the Affordable Care Act compliance and ethics program mandate, which is effective right now. Look at all of those regulators to see what they're looking at, right? And then within that, identify which ones apply to your organization. You also need to look at what's happening in your organization, right? So the OIG just came out yesterday with their unimplemented recommendations for the year. Well, it could be that 10 apply to your organization, but 2 are really high risk, 5 are moderate, 3 are low risk, et cetera. So make a list, and you want to prioritize based on how important the government sees it, and then how much of a risk it is in your own organization. If the government is really auditing something and you're in tip-top shape on it, it's lower risk for you, even though it's higher risk for the government. So get your team together and make a plan, and then assign priorities. I like the priorities to match up to some kind of an audit chart. I'll show you what I use. I made it up, but I think it works. So assign low, medium, high, and immediate risks. The way I do that with my clients is if it's low risk, we audit it annually. Moderate risk or medium is quarterly. High risk is annually, and immediate is we're on it now until it's fixed. So whatever works for you, have some kind of a chart that ties risk to audit frequency, and then revisit it every month because it will change. What is our next tip? The next tip is to mingle. Get out of your office. And what I want to say here is I do realize that I'm suggesting that compliance personnel who are up to their ears in new regulations, overworked, under vacationed, and very exhausted, do just one more thing. So a few of my tips involve suggestions for doing some additional things or perhaps doing things differently. So the footnote to that is to go slow and think about a plan throughout 2022 to integrate some new practices in, because I know it can take time. And a lot of us are still honestly playing catch up, and still have to focus a lot on COVID and infection control. But I do think this is important for your compliance culture, is to get out of the office and really have face-to-face contact with your personnel. I think it's important anytime during compliance, but especially if you've had to put some of that by the wayside to focus on pandemic and just stick in your office reading a pile of regulations and providing advice all day long. There's not a lot of time to get out of the office, but let's make the time in 2022. We do a lot of compliance surveys here at MPA for our clients, anonymous surveys that ask employees if they know about the compliance officer, if they know to, if they would go to the compliance officer with questions. And those surveys can tell a lot. The organizations with a compliance officer who's able to get out of the office and talk to people regularly tend to do better on those surveys. The more visible the compliance officer, the more face time with staff, the more people will go to that person when they have concerns or questions. So what does this look like? If you're small, if you have a single site organization, it's easier, right? Maybe you just set aside a time every week or every month and you walk the halls and you have compliance flashcards or trivia or candy bars with your hotline number on it, anything to trigger a 2-minute conversation and a reminder, hey, I'm Margaret, I'm the compliance officer. Here's some reasons why you might come see me. My office is over there. Now, if you have a bigger campus, this will take more thought. You will probably need to enlist other people to help you. You might have compliance liaisons at each of your sites or locations, and you are coordinating with them to get the information out. Maybe you're making videos and sending them out on text alerts. There's different ways to do this, and it definitely looks different in different types of organizations. But the important thing is to have a plan and get out there, and you can start small. Start with 10 minutes and just see what happens. Similarly, I encourage you to get people's attention. Compliance has a reputation for being really boring. I'm not going to lie. When I tell people what I do, sometimes I get a blank. Michael's laughing. I know it happens to you too. I get a blank stare, or a groan, or a and I kind of understand that. Compliance has a reputation for being boring. In some organizations, it feels like a hammer, right? If there's so much to do right, and if I get it wrong, I'm doomed. So if that's how compliance feels, it's just time to rebrand. Compliance is not going to be as scintillating as whatever you watch on Netflix or Apple TV when you get home, but it can be helpful. It can be relevant, and it can even be cute. I have some examples of it being cute. So if compliance needs a little bit more attention in terms of your branding, think about that. Also, people are exhausted, right? Everyone's tired in healthcare. If we can make it a little more entertaining, let's do it. Some examples I've heard of, City Court did a really cool video campaign where they interviewed different leaders, where they had the leaders walk through a compliance program they faced and how they overcame it. That was extremely relevant and interesting and helpful for employees to see their leaders who have gone through challenges and overcome them, and how to do that in the organization. Another colleague of mine who is compliance officer for a healthcare provider in the Midwest, she came up with this pet posters campaign. She challenged everyone in the organization, take a picture of your pet, don't have a pet, find a pet, take a picture, put a poster, put a slogan on it. and a compliance related one. And so she got all these pet posters in, and then people voted on them and they put the favorites into a calendar that everyone gets. She also used the posters as a way to start a conversation. For example, some of the posters would come in with really slogans that fit with that hammer feeling I was telling you about, like be compliant or else, and there's a really angry pit bull on the poster. So she'd call them and she'd start a conversation with that person and kind of tell her side of the story. Like, well, actually, I'm here to help you and make your job easier. So those are just some of the ideas of how you can make compliance a little more relevant, helpful, interesting, maybe even cute. All right, my fourth tip is to show gratitude. Like I said, it's been a long 18 months. And now we're also asking people to really get back to compliance tasks. I just invite you to look for ways to say thank you when someone, I have some good examples. If someone comes to you with a good compliance question or a non-anonymous compliance report, or they finish their audits on time, or they get 100% of their employees to training, or they disclose a potential conflict of interest, any of these things, write a thank you note, put a copy in their file. That can go a long way. And my final tip before I turn it over to Mike is to update your HIPAA security risk analysis. The risk analysis, it's required by law and industry standard. It's updated every year. I update ours all the time whenever things change, but it's required. We're seeing a lot of enforcement here where there's a HIPAA breach, the OCR investigates, they find, well, you didn't have a risk analysis, or you hadn't updated it, or you didn't cover everything. And then big settlement. The risk analysis is also the #1 way to find out where you have risk that it could expose you to a breach or a cyber attack and fix it. So if you haven't done that, or if that's fallen by the wayside during the pandemic, it's time to get that on your calendar for 2022. Mike?
Thank
And
you.
Before I just wanted to jump in real quick before Mike continues on, is we had 2 questions come in from Michael that I wanted to address real fast. Yes, I didn't say this. You will get these slides as part of the follow-up. So you will get all the information. And then Michael asked a different question about a little bit more about SAM.gov released an update to their website and some of their user experience on how to search for exclusions. Michael, looks like you're asking for a little bit more detail about that. I will drop a link to, we actually wrote a blog post about this, about some of the updates. So while Mike Rosen is telling you about tips 6 through 10, I'll drop that link to just a quick how-to and an overview of some of the updates to SAM.gov if that's on your mind coming into today's session. So good questions. Thanks for reaching out. I know we got a few others, but I'll let Mike go on and then we'll address some at the end of tip 10. Mike Rosen, take it away.
Thank you, Dave. Margaret, I loved your pet poster. I think that was a doggone good idea. All right. If you can't take yourself seriously, who are you going to take serious? All right. Number 6. There's a lot of data out there, right? And everyone has it. And now everyone is a double-edged sword, right? Because sometimes the data that you have can be used against you. And you also need to be able to, as Margaret was indicating, to make sure only the appropriate people have your data. If it gets out through a breach, that's a whole nother measure, and why you need to have the risk analysis that she just referred to. What we're talking about here, though, is for those of you who have any type of data analytics software like Tableau or otherwise, it's really important that you take advantage of this information that you're gathering on a routine basis. Information from certain compliance committee metrics can be, found or delivered here. Information in particular from hotline call metrics would be some of the things we're talking about, any audit findings or other internal business review metrics that you have. Again, if you're getting it but not looking at it, that can really be used against you, and you don't want that to be the case. Since we're giving you tips on how to be positive and proactive, look to see if you've identified any weaknesses in processes or new areas that need to be reviewed and audited for next year. They may be based on resources, lack of resources, or just whatever. It's things you couldn't get to, but you now know the data shows really needs to be the focus. And since you're bidding, if you will, for your budget next year at this time of year, now's a chance to raise your hand and say, I need more dollars, I need more people, I need outside resources, whatever those are. This is your chance. Forever say it or forever hold your peace, because the better position is to say, I really needed this, and management chose to fund it, and good for you, or management didn't think it was important, but you, at least as a compliance officer, you raised your hand. Okay. So look for weaknesses or ways that you can be better, and then try to look at the metrics on an aggregated basis, not just in their own individual right, because until you see things as a pattern, the data may not jump out at you individually. So these are some of the things that you're already getting. The question is, how are you using it to benefit and be better in your organization? And so that's a tip that we feel like, we could spend a whole webinar on, but in the least, if you will, start making sure you know where that data is and be checking it and analyzing it. Number 7, software can make your life easier, right? We all use it. We all use different forms of it. And any way that you can automate processes, sometimes that's for the better. And sometimes you can falsely be relying on something if it's not good software. So kind of look and see. We actually did an audit ourselves of all the software that we use at our company to support our services, and found that some employees had signed up for $5 websites that helped them, and we had not been able to vet the security of those websites or apps. It may have been something that a developer found helpful, but we needed to know what it was. And so we now have captured all of the pieces of software, and now we don't allow our staff, by way of example, to sign up for Monday.com, for example, without letting us know and vet that Monday.com is secure. So even from that lowest level that you hadn't thought about, could cause you some increased risk of exposure. And then obviously the big payroll providers, the background screeners, monitoring companies, the HIPAA assessment softwares. We're also talking about that because a lot of people put time and effort as expertise in what they do to make your life easier. And if you can, take advantage of it. There's hotline call centers. There are exclusion monitor screening services like ourselves. We're here to help make your life easier so you can focus on much bigger and more important things. Number 8, partner with HR, especially when it comes to employee satisfaction. Look, we know even in our own organizations, we're tired, we're exhausted, we're zoomed out. We're toying, do you come back full time if you're not a hospital provider in which you have to be present? There's different organizations and suppliers that are dealing with all levels of employee satisfaction or dissatisfaction. So we all know our staff, including ourselves, are overworked. There's a lot of pressure. There's a lot of unknowns that leadership's trying to figure out, right? Should we come back to work? What are these new COVID protocols going to be? And yet the regulators are not pulling their foot off the gas pedal and saying, oh, that's okay that you had a breach. We understand. That's okay that you're overbilling, or that's okay that you committed, a kickback. We understand you're short-staffed. That's not going away. And so when you do prioritize, like Margaret referenced before, what are your higher risk areas? These are the ones you really need to focus not only on finding out if your employees themselves are happy and satisfied and feel loved. I think you'll find that in most of the cases, certainly that you read about in the OIG and otherwise, and Department of Justice goes after, today it was a lack of oversight by the company and employee dissatisfaction that led to the reason that they did this. And that's why whistleblower complaints have risen in the last decade. And that's why they're there. That's why they're giving monetary retribution to those who bring it forward, because if you're not going to deal with it, if you don't really have a finger on the pulse, and somebody has a moral compass on your employee, they're going to turn you in. And that's just not a place where you want to be. So recognize these things kind of all work together. And the better satisfied you can have your employees, and that they understand the vision and they understand that compliance matters. And like Margaret said, they know where your office is to come say something, the better you'll be for 2022. Number 9, review and update your audit plan. Audit plans are only as good as they are current, and they have to be looked at from a risk analysis to see whether you're actually finding things or finding or even looking for them, for that matter. So concentrate at first on your high risk areas, but don't forget about your low risk areas. They may be low risk, but they may cause you high pain down the road. So just because they fall on the lower scale doesn't mean they can be forgotten. It does probably mean that they'll be second in line, if you will, but should never just be parked and forgotten about. So compare your current audits to your high priority areas of business and adjust and move forward. Your plan should always be changing because your business is changing and the pressures are changing and the reimbursements are changing and the laws are changing. And that's why either access to great products like HCCA puts out for resources, or Becker's online, or there's a multitude. I subscribe to several, or they're free, law firms that I think are really on top of it across the country when it comes to healthcare laws. And that's how I'm keeping up with an area that I know you're worried about. Likewise, Margaret and her team can help you with those resources. But HCCA is certainly a great place to find a bunch of information. All right, number 10, and then we'll open up to questions. What do you know about your vendors? This seems to be, when we reach out to our prospects and customers, the area that gets the least amount of focus. It's the least sexy among the sexy. If you think HR is not sexy, you think compliance not sexy, vendor management and procurement is usually in the basement of a hospital. And sometimes if you can find their, we went and delivered an RFP to one, and actually the response was, how did you find us? No one knows we're in the basement. Literally, they were in the basement of a hospital. And so it's usually not the most best funded. There's not a lot of software out there that's focused on vendors because it's not a sexy need. It's so important to what you do. There are so many vendors that you work with. What we find, depending on whether you're a hospital or a nursing home or long-term care, you're going to have between 1 and 1.5 times the number of vendors that you do employees. That sounds crazy, but when you think about a rural hospital system, 80% of their vendors are local in a small town in Oklahoma. They're not doing business nationally, they're doing business locally. Now, there are 20% that are the big providers, the Pfizers, the Johnson & Johnsons, everybody does work with them. So there's a lot of room for fraud. And so what do you even know about the vendors? Do you have a tax ID on them? You'd be surprised, I think, if you ran a search through your database, how many you're missing. So you're not even reporting necessarily properly on 1099s and W-9s to the IRS, and you don't necessarily know who owns that business and whether they're excluded. Do you know if they handle PHI? If they do you have a BAA? Where would you go to find that? In most hospitals we talk to, there's no one system that ties it together, so they're having to talk to multiple departments. That's scary for compliance. And so for multiple reasons, really pay attention to who your vendors are. They can cause you a lot of pain. And there are some simple solutions out there in which you can capture what you need to verify and monitor their compliance. And ask them, are they monitoring their own employees for exclusions, right? So you say in your contract that they have to do it. Are you checking that they're doing it? When it comes to the OIG, they don't go to your vendor, they're coming to you and saying, well, you do business with them. So a very important area. And of recent, obviously, if they're coming on site, do they have vaccinated employees? Are they properly credentialed, and all those related issues? So these are the areas we think you should focus. And Dave, I think if we have a minute or two, we'd be happy to address any questions.
Yep, we do. We have a few questions that have come in. I'll also say that a topic that we and certainly Margaret and team are paying attention to is waiting on the guidance from CMS, which should be coming out any day, is around vaccine mandates for Medicare, Medicaid facilities and organizations. My guess is that touches or impacts most of the folks on the phone today, and we've quite a few. And so as it relates to sort of these acute moment in times as well, what these are 10 generic tips, but we touched on some really specific ones, especially in that last slide. Both of our firms, we'll talk about this in a second, are really committed to making sure that when guidance like this comes out in the next any day now, where it literally is committed to be late October, so we're waiting on it any day from CMS, that you can come to either of us for questions or education or interpretation if that's something that needs to be. So we will, both of us are committing to really make sure that we're keeping relevancy and keeping current events and current regulation top of mind as well, because that certainly relates to everything that we've discussed today. We had a couple questions come in. One is from Vera, which I think this is a good one, probably for Margaret, is when your compliance department's really small, do you have any best practices for how to prioritize really effectively?
Yes, and I think first of all, most of my clients are in that position. Most people I work with are in that boat and just trying to bring in additional resources because there's a mountain of tasks and not enough time. So I recommend the triage. Make a list of everything, every risk you have, everything you're going to do to address it, right? So your training, your meetings, your policies, and your audits, spread it out on a 12-month calendar. Your monthlies, your quarterlies, your annuals, your one-time things, spread it out, and then take a look at it with you and anyone else on your team. I think this one's 2 people. Can you get it done? Well, not losing your mind. If the answer is no, go to your compliance committee. Can anyone on the committee help? We need to just get these tasks done. Who can help with this audit? Who can write this policy? Compliance by team. And if they're still not enough, that's when you want to try and bring in a third-party resource, bring in someone to do audits for you, software like Mike mentioned, or try to bring in some resources to try and knock some of that down.
Helpful. One other question that came in, this is from Mike, which is saying, are there any free tools available to help with the HIPAA security risk analysis? Margaret, this is one of the things that you touched on earlier in the session today. We don't know where to start.
Okay. Yes. Well, it's kind of, I hear that a lot. So healthit.gov, it's a government website devoted to health IT. They do have a free tool that you can download. It's a software-based tool. It is totally free. My only footnote to that is that if you use that tool, you also need to conduct a PHI inventory because that's not in the tool. Last time I checked, I know they recently updated it, but I believe they don't have that. And that's always where I start with a risk analysis. There's also a lot of security risk analysis, how-to guidance on the NIST website, NIST, that's a government agency, about standards and technology, and also the Office for Civil Rights. If you go to their website on their HIPAA side, they've got a security working paper guidance about the risk analysis. Email me if you want me to just send you all of those links, and I will.
Helpful. Thank you, Margaret. Last question for today that has come in is, this is from Jill. Would you be willing to share, Mike, this is to you, would you be willing to share the 3 law firm names you follow for healthcare law updates?
Sure, of course. And Margaret, you can add others. There are lots of great firms. Because we're in Nashville and it's such a healthcare centric town, there's a lot of great lawyers specializing in that area. I happen to think Waller, W-A-L-L-E-R, Waller Law is really good, and they're up to speed in this area. They're big speakers at HCCA too. Bass, Berry and Sims has a great healthcare practice. Also in Nashville, probably on a national scale, there's McDermott, Will and Emery. MWE, they're very up on specifically the reimbursement side of it. They do national conferences, and Quarles and Brady up in Pennsylvania, I think is pretty good. They've got a former OIG enforcement lawyer on staff. So those are some of the ones that I follow. There are a lot, but I would start with those. Margaret, if there's any other ones you might suggest.
Yeah, those are fantastic. I also like Polzanelli for healthcare, Hall Render, and both of those have a lot of free education, free webinars. And then Bricker and Eckler is an Ohio firm that I like for more of the OSHA stuff, if you're looking for that.
Mm.
So feel free to ask either of us, or we've got blogs on our websites with some of the things you might be looking for that would give you a link or a link to another firm in which we're quoting.
For sure. We had a couple of requests to get the contact info of both of y'all. We'll be sure to send that out. And if you're looking to get in touch with either Margaret or Mike, just be on the lookout from the follow-up email from ProviderTrust. That'll have all the resources, the recording. It'll include contact info as well. I promised earlier I'd share the blog post about sam.gov, and then realized as soon as I turned off video that I was sharing my screen. Couldn't do that in the middle of the webinar. So I'll make sure, I've already told our team to make sure that sam.gov article makes it into that same email as well. So I know I keep referencing this magic email that's coming, but it is be on the lookout for that later this afternoon. I believe that is it. All the questions that have come in, we appreciate you spending a couple of extra minutes with us to get some questions answered live. Again, be on the lookout for all the things from ProviderTrust. We have a few, the last couple of slides that I would share is one for each of us. If you're looking for free education, both of our firms do that often, especially with current events and what's going on in the world right now. ProviderTrust.com has a content library with over 700 resources in it. So, and what I would highlight is we are in the middle of a bi-weekly series on the vaccine mandates, what we're seeing, what we're hearing. And if you're looking for a little bit more of, as the regulations coming out, what are we hearing from the market? What are we hearing from our clients and some of the brands that we work with? It's a great place to go. Our next one's next week. We did our first last week. Our next one's next week. And hopefully we hope to have the CMS guidance in hand by then. And if not, certainly we'll host one as well. And then the other one is, I would say, is absolutely browse MPA's resources as well, healthcareperformance.com. They have a ton of webinars, downloadable content, blogs as well. So if you're looking for education, these two organizations, ProviderTrust and MPA, are great places to go for ongoing resources. Certainly you can start with the speakers on the phone, but I would really encourage you to browse the content libraries as well. That's it, friends. If you have any questions at all, feel free and reach out. With that, we'll make sure you get everything, get everything that you need sometime today. Mike and Margaret, thanks for the time. And with that, that concludes, friends.